Alrighty. Hello, everyone. Welcome to the latest in public health research. I'm Jen Ahern, your Associate Dean for Research at Berkeley Public Health, and really excited to welcome our speaker today. We have Dr. Matthew Raifman. He is a transportation safety researcher with expertise on estimating co-benefits of sustainable transportation and experience modeling transport-related physical activity, estimating health effects of air pollution, and quantifying disparities in traffic fatalities by race and ethnicity. I'm not sure, maybe he'll share a little bit about his path, but he's been at SafeTREC as part of sort of that research team for, I don't know how long, but maybe he can tell us. But in that context, he's looking at how changing composition of passenger vehicle fleet impacts incidence of traffic fatalities, looking at how automated vehicles affect road safety, which I have curiosity about as someone who spends time in San Francisco wondering when I'm going to get hit by one of those things, and looking at novel approaches to setting speed limits in the US. So this should be really interesting. Just a reminder for students who are enrolled for credit, Lauren has put a link to the sign-in sheet in the chat. And I think that's all of the preamble I need to say. So I will hand it over to you, Matt, for your talk.
Wonderful. Well, thanks for having me today. Just making sure I have the chat up just in case folks have questions. Yeah, I'll share a little bit about my background and whatnot. And then if folks have questions, I think it's probably most efficient to save them for the end. And I think that's probably the right way to handle it. So thank you for having me today. Today I'll be talking about active transportation, which, as you'll see, we define as generally forms of transportation that burn extra calories beyond our calories at rest. And how active transportation can be a climate and health solution. But as you heard from the introduction, my path to this position and to this research has been meandering, to say the least. There was a point where I was working in the industry, so I was launching autonomous vehicle pilots at Ford Motor Company. Before that, I'd worked in the think tank world for a bit, and prior to that, had worked in government doing performance management around things like transportation with the state of Maryland and with a couple international organizations. So kind of a crazy background. Did my PhD at Boston University over the COVID years and finished up a couple years ago and joined UC Berkeley at the SafeTREC Center where we research transportation safety. And so I've empathy for any of the students out there who started during the COVID years because it was a weird experience. But anyway, let's get into the talk, and then I'll save time for questions at the end. So just sort of an overview of what I'm going to talk about today. I'm going to spend a little bit of time talking about the context of climate and health. I think actually that's a lot of the interesting work is to understand how these intersect, the nexus of transportation, climate, and health. Then we'll talk a little bit about what active mobility is, and then I'm going to go through two papers that I was first author on that have been published. One was on Transportation Climate Initiative, which is a policy focused on climate ostensibly, but has these transportation or these health benefits, these co-benefits. That's more of a modeling health impact assessment type work. And then I'll talk about a second paper, which is more descriptive in nature, and it's describing traffic fatalities by race and ethnicity after adjustment for activity patterns. And then I'll conclude and we can jump into questions. So a bit of the context. So I think the elephant in the room, and I used to have like an elephant for this, but I think it's a better way to show it, is auto mobility as a concept, and that it is very much the status quo in America and in a number of countries around the world. Automobility is very closely tied with the concept of freedom. Now, this is a marketing goal from the auto industry, and we could spend an entire hour just talking about that. But it's important to note that the status quo has been around automobile transportation in the United States for basically the past century. And I like this. I mentioned I worked at Ford, and we actually use this as a way to kind of talk about where we're coming from. And historically, Ford and other manufacturers marketed the automobile as freedom. And, my generation, when I got my driver's license, that's what it was to me. It was freedom. And where we are now, though, in the modern era, is probably something a lot more like what you see on the right side, right? At least in urban environments. It's congestion, it's travel time issues, it's stress and anxiety about work commutes, it's air pollution and noise pollution, and a creation of a built environment that exists primarily to serve automobiles. And so, if that's the status quo, the implications for transportation and health are myriad. And I like this schematic really that was developed out of the folks they're in Barcelona. It's IS Global, and their program. What they've done is they focused on the policies and the social implications of these policies and how they interact with urban design and our mode choice, our behavior in transportation, to affect health in morbidity and mortality pathways. So largely kind of taking this, without going into so much detail, the policies that we choose at the state, federal, local level have implications for the way that we design the environment that we engage in when it comes to mobility. Now, that has effects on population density, how we use land, the distance of our trips, how we design the mobility system, the connectivity that we have, the infrastructure when it comes to road infrastructure, but also for pedestrian and cycling and other forms of mobility. And those things in turn are shaping our behavioral choices. So do we spend time indoors or outdoors? Do we choose to walk, bike, cycle, take public transport or other modes of transportation when we go on a trip? And those combined decisions of our urban design and our behavioral choices affect our health. And it can affect our health through environmental factors like air pollution and noise, temperature like urban heat island effect. When we've designed a world around concrete, it can exacerbate those issues. But those also affect our own physiological state. Are we stressed? Do we have dopamine hits from social interactions? Are we isolated? Do we engage in physical activity? Something we'll be talking about today. And those things can have acute and chronic health implications. So thinking about the climate piece of this for a second. So transportation in the United States is now the largest contributor to greenhouse gas emissions. This shifted around like the late 2010s. And this is in part because of a lack of progress in the transportation sector and a progress in the power sector, mainly the transition from coal to natural gas and relative reduction in greenhouse gas emissions. But as of today, or this kind of era, transportation is the largest greenhouse gas emitter. And within the transportation sector, light duty vehicles, which would be trucks, cars, vans, SUVs, these are the dominant source of transportation related greenhouse gas emissions. So that's to say the way that we get around and the choices that we make have major implications from a climate perspective. And to put a little bit finer point on this, if we think about life cycle greenhouse gas emissions per mile traveled, or here it's estimated per kilometer traveled, the same thing. So the folks over at International Transportation Forum, which are in Europe, have done a pretty good job of thinking about the conceptual life cycle greenhouse gas emissions. And the reason why I include this slide and want to spend a moment on it is because I think the biggest point here is that it doesn't matter if you are driving a battery electric car, a plug-in hybrid vehicle, a fuel cell vehicle. Private cars are less efficient from a greenhouse gas emissions perspective than pretty much every other form of mobility. Of course, they're more efficient than walking, but they're also more efficient than transit, mopeds, e-bikes, scooters, you name it, basically. And so when you take into account the full comprehensive emissions from an infrastructure, from the construction of a vehicle to the fuel to operate it, generate power in the case of electric vehicles, they're pretty bad for the environment. And electrification does not itself solve this problem. So putting a layer on that, if we think about what we could do instead of driving a private vehicle, well, there's actually like a fair amount of trips that could be done by something other than a car. Now, there are two ways to look at this that I share here. One is using census data, the chart on the left. And this is a survey question that asks respondents how they get to work, how they commute to work. And in the census data, if we look at the national, ignoring the green for Berkeley, because we're exceptional, but if we look at the national level, the vast majority, 70% of Americans, even after COVID, are driving alone to get to work. That's the primary mode of transportation, not carpooling, driving alone. About 13%, which is way up compared to pre-COVID years, 13% of 14%, if you round up, of Americans are commuting to work by working from home. Some are carpooling, some are taking transit, some are walking, and an even smaller portion, less than 1%, are cycling. If you look at a place like Berkeley, it looks quite different, right? A third of the Berkeley population, 30%, is working from home right now. But still, after working from home, driving alone to work is the next highest share. But if we look at National Household Travel Survey data, which is a survey that's conducted every couple of years and surveys respondents on their trips, so this is looking at all types of trips, commuting and recreation and everything, we can see that over 50% of trips are 5 miles or less. So those 5 mile or less trips are really prime candidates for walking and cycling and transit. And over 50% of trips are fitting into that bucket. So there's a lot of opportunity here for doing something other than driving alone in a car. And then finally, I want to put a little bit of a spin on this, which is to talk about the age of car bloat. And this is a term that's been applied to kind of where we are now with vehicle sizes and weights. And this is data from the US EPA that comes out every year. And on the y-axis, you can see curb weights. This is the weight of the vehicle. And on the x-axis is time. And then we have different lines for different types of vehicle form factors, ranging from sedans to SUVs to pickup trucks. And what you can see here is that whether it's a sedan or a pickup truck, all vehicle form factors are getting heavier over time. And specifically the larger ones, like pickup trucks, are growing at an even faster rate in terms of their size. So vehicles are getting much heavier over time and have been for the past couple decades. On top of that, though, and this all matters from a safety perspective, people are also shifting the types of vehicles that they want to purchase. And so the big green section in the top that's getting much smaller, this is production share on the y-axis, is the sedan and wagon share. So what you can see here is people are switching from sedans and wagons, and they're largely switching over to truck SUVs and car SUVs. And that transition means that, yes, all the vehicles are getting larger, but there also is a difference in the vehicle, in the mode or in the form factor choice of the population to switch over to the even larger sized vehicles that are available. So it's this 1-2 punch that's happening right now and has been for the past decade or so. It's precipitating a shift towards larger vehicles that are more polluting, more of an issue for noise and air pollution, also a big issue from a safety perspective. So with that, I'm going to pivot and talk about physical inactivity or physical activity. So first, we have to define what physical activity is. So the WHO offers a pretty good definition, I think, and a simple one, which it should be. It's any bodily movement that's produced by the skeletal muscles that requires energy expenditure. And we can translate that concept of energy expenditure into something called a metabolic equivalent task unit. Now, if you go to a gym and you use equipment and it gives you a MET level of value, that's what this is. So this is the amount of oxygen consumed by the average person who's at rest. And it's essentially a measure of exertion. And one MET, one metabolic equivalent task unit, is equal to how much our bodies are consuming right now. So you guys listening, I'm probably higher than a MET because I'm presenting and excited. But for everyone who's just casually listening at home, you're basically at a level of exertion of 1 metabolic equivalent task unit. And then if we want to measure exertion over time, we use a measure called metabolic equivalent task unit hours, which is just the amount of energy it's consumed over a period of time. So if we go a little bit further from that perspective, it's actually an incredible, it's kind of fun to look through. If you look through this 2024, any of the years, compendium of physical activities put out by the Journal of Sport and Health Science, you can get MET values for pretty much any activity. Now, some of these are interpolated, some of them are, the core ones are measured through a lot of survey studies. But these are different values. They're associated with different forms of activity. Now, in the stuff that I'm going to talk about today, I'm really just going to talk about cycling and walking from a physical activity perspective, because those are dominant forms of active mobility. But it's also worth mentioning that, things like kettlebell swings, which is a type of workout, or competitive ballroom dancing, have very high levels of exertion and a consumption of oxygen, which is perfectly related to calorie consumption or calorie exertion. And things like e-bikes, which have some support, also provide some level of energy exertion that's above resting at 1. So keep that in mind. This is average. This is through survey work. This is standardized for the population, and every individual has a totally unique profile when it comes to their energy exertion, their metabolism, and their general kind of package of how they burn and consume energy. But because of the importance of physical activity and the volume of research around it, from epidemiological and from population health perspective, the Surgeon General, came up many decades ago with the concept of a sort of generalized recommendation of a level of activity. And recently, in the last decade, I think they added the weight-bearing exercise to this as well. So the idea that we need, on a general population level, about 150 minutes of moderate activity. Moderate activity is 4 metabolic equivalent task units of activity. That's the level of exertion. So if we go back here, that's something that's sort of akin to a very brisk walk with a load, so carrying like a child or something, or like a light e-bike ride or something like that. So moderate level of activity, about 150 minutes per week, and some level of weight-bearing, muscle strengthening activity as well. Most Americans are not getting that minimum level of recommended physical activity. And this is data from BRFSS, from the CDC. And they look at, it's a survey question, it's a prevalence, it's a self-reported survey of physical inactivity, the proportion or respondents who are not meeting those guidelines. And we can see spatial variation across the United States that's clearly notable. Specifically, the southeast of the United States is relatively inactive compared to the other parts of the country. But also it's worth noting that even the most active areas, namely Washington, Utah, Colorado, and Vermont, not California, those really active areas comparatively are only about 15 to 25, or sorry, are 15 to 20% are reporting that they're not meeting the criteria. So 80% to 85% of those populations are meeting the criteria, but it's not like we're getting to 100% here. So there's a lot of opportunity in this country to increase physical activity from a health perspective. And I think there's certain areas that you would target resources or allocate resources based on opportunities for health improvement with increased physical activity. We can also look at population survey data that looks at stratifications by different groups. So we can look at men versus women, and race and ethnicity, and income. So here what we're looking at is men and women, as well as race and ethnicity. And this analysis age adjusted. And what it shows is that when we look at men, Hispanic men are typically having a smaller share that are meeting the activity guidelines compared to other race and ethnicities that are tracked. And then for women, non-Hispanic white women are just basically a step ahead of every other race and ethnicity group that is tracked. So we see differences between men and women. I think this is actually interesting because I would not have expected this, but men seem to be more likely, at least, to self-report that they are meeting the activity guidelines than women. And that I thought was notable as well. So one thing to point out here is, unfortunately, the way these analyses are done is they're typically only looking at non-Hispanic white, Black, Asian, and then Hispanic populations. This is excluding a lot of different race and ethnicity groups that should probably be included because they tend to have higher comorbidities and health-related challenges that could be benefited by walking. For example, cardiovascular disease, respiratory issues, COPD, and things like that. That's typically because of survey sample size, but it's an omission, not by intention, but because of the lack of data. But it's not my omission, because I do think it's really important to think of who's not included in these types of data sets. So then if we look at income adjusted, so this is federal poverty level, we see a very clear step pattern here, which is the more affluent you are, whether you're male or female or other groups, the more likely you are to meet the activity guidelines. And there is a very clear relationship with income here too. So we see disparities by income and race and ethnicity. And interestingly, the COVID pandemic created this shock that made it really compelling from a public health perspective to study a lot of these things. And so one thing that was interesting that I wanted to mention here related to active mobility is that the pandemic inverted activity patterns by income. And so we saw, what I mean by that is some survey, this actually pretty interesting work that used not survey data, it used cell phone data, I believe. So part of the treasure trove of data that was passively collected and then made available during COVID. And what this shows is that when you look at by income quintile, all groups were less likely during the pandemic to walk. The distance that they were traveling for utilitarian, for work-related activities went down. But even just within the orange bars that you can see there, you can see a relationship with income. And so lower income populations were decreasing their activity more than higher income populations. Now, some of that kind of makes sense because of the different job types. But what's really notable here is that when there was this shock, when folks were able to engage in leisurely physical activity, which was both for mental and physical health benefits, the people who were able to engage in those types of activities were primarily wealthy individuals. And so we already saw these disparities. Note, these studies that I talked about here were 2020. We already knew those disparities were happening. They've only become exacerbated during the pandemic between the haves and the have-nots of who's able to engage in this case, leisurely physical activity. So the relationships between physical activity and health are myriad. They've been studied pretty extensively. So there's a couple of points I want to make here. First is that there's a broad range of health impacts, from all-cause mortality, different types of cancer, cardiovascular disease, diabetes, and then things like dementia and other brain health, and mental health issues like depression and anxiety. So those have been studied both in the context of generalized physical activity, and these relationships have been established historically looking at any type of physical activity. And more recently, in the past decade, studies have been coming out that look at specifically walking and cycling or other modes of active mobility. And what's important to note there is the relationships are somewhat attenuated, meaning they're not quite as strong when you look at walking and cycling compared to general physical activity, but they're still there directionally. So we expect directionally the same types of relationships between walking and cycling activity as we do these established studies that look at generalized physical activity and health implications. The second thing I wanted to mention is what you see on the right here, which is this curve. And you can see it's not a linear curve. And the point here, this is looking at all-cause mortality, but it's generally the case for most of these health outcomes. And this is a relative risk curve. So what we're seeing here is that there's this nonlinear response pattern from a risk reduction approach to increases in activity. And so I like to think of this, and I mentioned I used to live in Boston. So the thing about Boston is you have the Boston Marathon. And I used to think of it as like the people who are running the marathon versus the people like me who are watching the marathon. And the point here is that if the runners and the couch potatoes all increase their activity by about an hour a week, the runners are going to get a lot less of a health benefit than the couch potatoes like me. Because going from relative inactivity to a little bit more activity puts you a lot higher on this relative risk curve slope than it does from going from a very high level of activity to a bit more of activity. And this is modeled in a lot of the health impact assessment work that's coming out now. I'm not going to talk about a paper that I did that does use this type of approach and does an individualistic approach to modeling the health impacts. But generally, because of this and the granularity and spatial granularity of data, this is omitted from a lot of health impact assessments that look at population level shifts in activity patterns. And so it's important to note that this disconnect between some of the cutting edge, or really just epidemiological research, not even cutting edge, just the standard epidemiological research around physical activity, and the health impact assessment studies that are conducted in this space. So finally, I want to just talk about the costs. And so, there are opportunities to do health impact assessment or just estimates around costs of physical inactivity on society. And one estimate is estimating about 500 million preventable cases of non-communicable diseases at the tune of about $300 billion per year. And another study is kind of commensurate with that, says in the US, about 2.4% of healthcare expenditures, or about $24 billion a year, could be attributed to physical inactivity in society. So with that, I will jump into paper number 1, and we'll go into the second paper pretty quickly. So this work is focused on something called the Transportation Climate Initiative, which was a policy effort on the East Coast to implement a cap and invest program focused on transportation emissions. And our work was to estimate the health impacts associated with that. And the general idea here was that there's a cap and invest system that sets a cap on greenhouse gas emissions. Then there would be a way to generate revenue, and that revenue could be invested in sustainable transportation and other things that might create a virtuous cycle to improve health in the region that it was implemented in. So the Transportation Climate Initiative, the idea is that there are these proceeds that are generated by the Cap and Invest program, and these proceeds would be invested in walking and cycling infrastructure that would increase level of activity. And that level of increased activity could both improve health from a physical activity perspective or have disbenefits to health through heightened risk of traffic fatalities. And finally, the health impact assessment would be the net reduction in mortality from walking and cycling changes in the population. So that is visualized here in a more complicated sense, but I just want to point out really from this, without going into too much detail, that you have 3 different models operating together. So you have an economic model that's going from a cap, a greenhouse gas emissions cap, and estimating a price for the allowances. That would generate proceeds that we invested in a input-output transportation model that would then take that investment and try to estimate how much walking and cycling activity would shift. And then finally, that change in activity is plugged into a health impact assessment model, which is what we did, which will convert that activity patterns in terms of miles traveled, walking and biking, into ultimately a net impact on mortality through relative risk functions, and then value that change in activity using a value of a statistical life approach. So that's the methodology. It's interdisciplinary in nature and has sort of economic, transportation, and health aspects to it. So we looked at this for 9 different scenarios. That's 3 different greenhouse gas emissions caps and 3 different investment scenarios. So 3 different ways to invest the proceeds out of the cap. And I'm just going to talk about 3 of those, which are all the 25% greenhouse gas emissions cap. And these are the results from our modeling. So we did this for almost 400, I think it was 378 counties that were in the region of the East Coast that was implementing this transportation climate initiative. And our results found that the net deaths avoided across the region were all positive. So the deaths avoided from increased physical activity were greater than the deaths that we estimate would have been incurred from increased fatalities due to the relatively unsafe nature of walking and cycling compared to driving. We also see that the monetized value of those benefits are greater than the infrastructure costs associated with building the infrastructure. And that's important because it basically says this on a societal level is a net positive investment for society if you're thinking about a cost benefit analysis. And then the other thing to note, final thing, is the variation in the different investment scenarios. So you can take the same amount of money, but invest it in different ways, different types of infrastructure investments. I won't go into too much detail here. But those infrastructure investments result in different expected net deaths avoided. And so that means what the policymakers do matters. How they invest the resources matters from a public health perspective. So we did this analysis, I said, for 9 different scenarios here. And we did it for all the different counties across the entire East Coast that was party to this policy or considering it. And so you can see the variation here in net deaths avoided across all the different states. And so one thing that becomes really readily apparent here is just the concentration of benefits in the New York, New Jersey, Pennsylvania region. So we see a lot of variation across the states, and we see a lot of variation across the different scenarios. So picking that apart a little bit more, we then looked at a population adjusted measure. So this is now net deaths avoided per 100,000 population. And here you see a visualization of all the counties across the East Coast that were party to this policy and considering it. And then darker counties are ones where you have a higher level of net deaths avoided per 100,000. So this shows that even when we adjust for population, we still see a very strong concentration in benefits across the I-95 corridor, which is where this interstate runs on the East Coast. So it's not just the reason why this is happening, this concentration in New York, is not just because of population levels, it's also because of other factors, because even when we adjust for population, we still see the same concentration. And the reason why this is happening is because the general way of investing these resources was highly based on population density and cost effectiveness of resource allocation. And so one of the points of this analysis that we made clear to the policymakers that were considering this is that cost effective almost certainly does not equal equitable. So the cost effective allocation of resources would be to target them where populations are sufficient to support new bike and walking infrastructure, and thereby result in larger improvements in health because of greater exposure to the new facilities. So if you're putting a new bike lane in New York or in New York City versus rural New York, it's not surprising that we'd expect more people to use it, and therefore the health impacts in aggregate to be greater in the city application. But that may not be the most equitable approach to doing this, and that may not be aligned with the policymakers' goals. So that's really an important takeaway of this work. And I'm going to run out of time because I always do, so I'll just jump to the next paper. But I do think that the point of this work, which was shared really largely with the governors that were considering engaging in this transportation climate initiative, is that their decisions matter from a greenhouse gas emissions and transportation perspective, but also for a health reason. And then the other thing I wanted to mention is that simultaneous to this work that I presented to you, there was another team that was looking at air quality impacts of the same policy interventions. And what we found was that the air quality impacts were about the same as the active mobility impacts from a health perspective. And that's notable because a lot of transportation projects, when there's a health impact assessment, they tend to only include the air quality impacts and the air quality pathway to health impacts. And by including active mobility, we're in this case essentially doubling the health impacts of a policy. So it may be beneficial to include active mobility when it's applicable, in these transportation health impact assessments and not just look at air quality impacts. Okay, so the second paper I want to talk about was disparities in activity and traffic fatalities by race and ethnicity. This is something that we published in Journal of Preventive Medicine a couple years ago. And I don't think it will come as a surprise to folks in the room, metaphorically, that traffic fatalities are a big deal. They're going up. They've gone up about 30% since 2010 in the United States. And troublingly, walking and cycling themselves as modes of transportation are not only riskier than automobiles travel, but they're also going up as a share of total fatalities. So as fatalities are going up, the share that are walking and cycling fatalities is also going up. So we have a concerning pattern and trend happening in the United States. That's so concerning that if you look at the top 10 causes of death, and this is data I just disaggregated from CDC Whiskers because it's not, motor vehicle crashes is not a separate category. So if you disaggregate motor vehicle crashes from other forms of accidental injury, I forgot the technical definition, you see that motor vehicle crashes or traffic fatalities are a top 10 cause of death for 7 different age groups. And this is so troubling because they're weighted towards younger populations. So when you would think about, like, conceptually years of life lost, right? Like DALYs and stuff like that. Motor vehicle crashes have a really, really significant impact on the population because it's the youngest among us that are more likely to die from this than other types of ailments. And as a non-communicable disease, it's largely a preventable thing in our society. And it's kind of unique in the United States. So this is work that was done in the MMWR, the weekly report from the CDC. And it shows, outlined here or circled in red here, is the United States. So 2 things are apparent here. One is just when you look at US motor vehicle crashes per 100,000, we're way higher than the other 28 high-income countries that were considered. And also, you'll notice the 2 different colors. They're black and like a lavender. And black is 2015. So you can see that over 2015 to 2019, all these other countries moved to the left. They became safer for for motor vehicle fatalities, not the United States. We haven't really changed at all. So we know that there are fatality disparities evident in our society. We know that when we adjust for even population, we see that Black and American Indian, Alaskan Native populations have a higher fatality. It's not really a rate, but just a high fatality risk in the population than white and Hispanic and Asian populations. But we also know intuitively, and this is something we show with the study, that there's differential activity patterns by race and ethnicity as well. So we essentially posit the question from a descriptive analysis question: what about if we adjust fatalities per mile traveled by race and ethnicity, thereby introducing differential activity patterns as well as these established disparities by race and ethnicity into the analysis? So we looked at 2 different data sources. One is the count of geolocated fatalities by race and ethnicity. This comes from FARS. We used a 3-year average to adjust for differences in year-to-year variation. And then we use an estimate, it's a survey conducted by a National Household Travel Survey that looks at person miles traveled by race and ethnicity. So this is introducing error and into the calculations. And so we do confidence intervals. They're generated by the survey analysis in National Household Travel Survey. And so we looked at fatalities per mile traveled by race and ethnicity. We also broke it down by race and ethnicity and mode of travel. So we looked at walking, biking, and driving a car or vehicle. And then we looked at urban areas only and during darkness, so during hours of darkness, not during a specific time period, but we adjusted the period we were considering based on the time of year to actually capture if the road was dark at that period. So answering this question of, do we see disparities in activity? The answer is yes, we do. we see that whether you look at walking, cycling, or light duty vehicles, if you focus on this first column here, you see different values across the different race and ethnicity groups. And so they're not as prominent for something like walking, but if we look at driving, we can see that non-Hispanic whites are on average driving 11,000 miles per year compared to about 7,000 miles per year for non-Hispanic Black. And similarly for cycling, we see really dramatic differences in activity patterns in the population, with whites and Asians far more likely to, or they bike a longer distance than Black and Hispanic population. So we can see here in the data from National Household Travel Survey and from adjusted for population, we can see that there are present disparities in activity patterns. So then what we did is we then created this rate adjusting for those activity patterns. And that's the visualization that you can see on the right here. And so this is the fatality rate for 100 million miles traveled by race and ethnicity, but also by mode of transportation and by condition, if you will. So any condition is all, and then just fatalities that occurred during darkness or urban hours. And you know, the confidence intervals are too large for our view, so we don't actually publish the results for cycling here for dark and urban, but we do for everything else. And what you can see is a systematic pattern. You see that Black Americans, non-Hispanic Black Americans, have a higher rate per mile traveled than Hispanic Americans, than white Americans, and all of those groups have a higher rate than Asian Americans. And we see that same pattern, with a couple exceptions, represented in all of the different scenarios. And so what this shows is not only are these disparities present, but they're actually greater when you adjust for differential activity patterns than people previously thought when we just adjusted for population level. And so it places even more emphasis on the importance of considering this as a twin problem of inequities in society, systematic disparities, and traffic fatalities. The other thing we can see here is clearly, if you look at the x-axis of each of these, you can see that motor vehicles are far safer. So we're talking about fatalities per 100 million miles in the order of single digits for a motor vehicle versus on the order for walking and cycling of hundreds. So they are much more dangerous in the United States forms of transportation than driving in a car. And that is deeply troubling. So I'm going to stop in a second because I want to leave time for questions, but just because it's a natural question of like, what are the potential drivers? And this is descriptive, so we're not going into a causal analysis here, but leveraging the existing literature on the topic, there are a lot of potential drivers of systemic disparities in transportation fatalities. You know, some of those range from investments in walking and cycling infrastructure and inequities in that. Others are in response time. You know, if you're hit by a vehicle, the emergency response time differs by race and ethnicity, the quality, which hospital you're taken to. The outcomes differ. Access to medical insurance could be a factor, as well as just implications of general income inequality and how that interacts with all the other examples mentioned here. So today I talked about physical activity and motor vehicle crashes, but I think it's important to recognize this is a visualization from the Texas A&M Transportation Institute, that the health and transportation pathways are vast, and there's a lot that needs to be studied, ranging from aspects that are beneficial to health to aspects that are detrimental to health. And there's a ton out there that I didn't even touch on today, but is worth recognizing in this space. And then finally, I just want to say that there is a transportation disruption that is underway. Now, it's happening more slowly than I think a lot of people expected about a decade ago, but we are seeing the implications of ride-hailing services, vehicle size, something I mentioned, autonomous vehicles, automated enforcements, be like tickets or red light cameras, speeding tickets or red light cameras, electrification, the working from home transition, and all these things are disrupting the transportation sector, and they all have a pathway or multiple pathways to affecting the public's health. And a couple things that we're working on at SafeTREC right now are vehicle size. So we're looking at, do larger vehicles hit vulnerable road users more than we would expect, given the distribution of registered vehicles. So are they involved in more vulnerable road user fatalities than we would expect them to be based on how many vehicles are registered? We're also looking at situational analysis of do AVs or autonomous vehicles perform better or worse than humans, and specifically interested in situations like speeding or mid-block intersections. So are the AVs stopping for pedestrians as they cross the road? And then something we're also interested in, and we've applied for funding, we'll see if we get it, which is looking at automated enforcement. So California is about to pilot, actually this week is piloting, starting speed cameras in San Francisco. That's the first state or first city in the state to get speed cameras, and there are going to be five other ones across the state. So we're interested in the question of, are these speed cameras effective in these pilot implementations at reducing vehicle speed? And do they shift vehicle patterns and travel in a way that might be also problematic? So are people speeding on roads that are right next to the one that has a speed camera, for example? Or do they slow down for the speed camera and then speed up in an unhealthy way or unsafe way afterwards? So these are just some of the questions that we're working on now, but I think all these disruptions deserve attention and study. So with that, I will wrap up and hopefully leave at least 5 minutes for questions.
Great. Thank you so much, Matthew. That was really fascinating. I learned so much. Yeah, please, if you want to add your questions in the chat, or feel free to unmute. We have a quiet group today. Here's a question. Which of the disruptions that you're working on now do you think has the potential to have the biggest impact? Oh, you're on mute.
So, okay, sorry about that. So yeah, it's a great question. It depends on what, right? So I think from a safety perspective, I actually think autonomous vehicles are really interesting because, you know, there are a lot of scenarios where human drivers are distracted, not paying attention, speeding, drunk, intoxicated, using drugs, things like that. So there is a compelling case for autonomous vehicles from a safety perspective. There are, of course, going to be situations where AVs don't perform as well as humans, though, too. So those have to be accounted for. If I had answered this question a couple months ago, I would have said that I'm very excited about the large-scale investment in walking and cycling infrastructure and the recognition of the importance of investing in safe streets. Unfortunately, a lot of the federal funding for that is drying up. So a lot of that emphasis is now coming on cities and states that are already being squeezed by other factors as well. So I think there's a real opportunity to create safer streets that are incentivizing active mobility that have beneficial health impacts outside of just road fatalities. But I'm not as bullish on whether or not that's feasible in the next couple of years, at least, because I just don't think the money's out there for dramatically shifting our mobility stance. So another question is, can you explain again why EVs are inefficient? Yes. So it's not so much that they're inefficient, it's that they're far less efficient from a greenhouse gas emissions perspective than walking or cycling or biking or scooters or mopeds and these other forms of transportation. The power for them is coming from somewhere. So if it's powered by coal or natural gas, there's still a lot of pollution, but you're offshoring or you're moving that pollution to communities that are largely actually tend to be lower income minority populations that are kind of forced through redlining and other practices to live near a power plant. And so in some respects, you're moving pollution from the street to the power plant. And unless we electrify and we do renewable energy in a wink or in a snap, really, we're going to face that problem of sort of moving the detrimental health impacts to other populations. So I mean, I think it's inefficient from that perspective, and it's also problematic from an equity perspective if you think about just air pollution. There's also a lot of inefficiencies with the use of space, and that's another thing, which is when we think of a car, and as I mentioned, they're privately driven most of the time. So that's a very inefficient way to move people and goods, is to drive this huge piece of metal and to require all the infrastructure needed to support it. So a bike can move a person in a lot less space than a car would take up, and that opens up a lot of space for other things like parks and parklets and bike lanes and things like that. And
Great.
Liza's chiming in with extra.
Yeah, thank you,
information.
Liza. Yeah, well, we're just about at time. So thank you so much for being here today, Matthew, and thank you for sharing your work. And I hope everyone has a great day. All right, thanks so much. Take care. Bye-bye.